In this video, we're going to talk about what a transfer might look like if you're using a slideboard or a Hoyer lift. In the first transfer training video, we talked more about body positioning and what a transfer is, as well as some safety tips. If you're interested in that information, be sure to go to the part 1 of the transfer training videos. One example of a piece of equipment you might use to help transfer is called a slideboard, which is pictured here. Some people like to use wooden slideboards because of the smoother surface. It makes it easier for your bottom to scoot along the wood. But if you're having any problems with your skin sticking to the wood, then you can also put a pillowcase around the outside, and then that pillowcase should also help you to move your bottom across the surface. The board will be placed under your thigh and bottom with your chair as close to the bed as possible. To help place the board under your thigh and bottom, you can lean and weight shift to one side in your wheelchair away from the side that the bed is on so that the board can be placed underneath. Once the board is placed, then you'll be using your arms to help push up and scoot your bottom across the board onto the mattress. Once you're safely to the other surface, then again you can lean to the side, remove the slide board, and keep it close by for the next time you need to transfer. Here's an example and a demonstration of what a slide board transfer may look like. So the first thing you'll see here is that I'm going to take my legs off of the leg rests and then remove the leg rests from the wheelchair to get them out of the way during the transfer. I'm doing this by unlatching a gray handle that's on the inside, shown right here, and then pulling the leg rest to the side and lifting up. Once the leg rests are off, you can unlock your brakes on the wheelchair and position it so it's directly next to the bed. This might take a little bit of adjusting back and forth to find the right spot and get as close as you'd like to get to the bed. Once you have that, then you'll lock your brakes. This is just another angle of being able to maneuver your wheelchair right next to the side of the bed so that there's no space in between. You can see that my hand can actually sit on top of the bed. I'll lock my brakes and remove the armrest. I'm doing this just by hitting a button and pulling up. Next, we want to get our bodies in a good position to move. So with my hands on the armrest and leaning forward, I'm scooting my bottom forward by pushing through my arms. Then I'll grab the slide board, the smooth surface right on top, and this edge is slanted. That will be the top of my slide board. I'll lean and shift my weight to the opposite side and place the slide board under my thigh and bottom. You can push with your arm from the armchair while moving your other hand across to the mattress without getting your fingers stuck in or under the slide board. Then once you're safely over to the surface, you can remove it. Here's another angle of leaning forward, scooting my bottom to the edge. I'll take the slide board and place it under my thigh and bottom. And by keeping my fingers and hand up after I place it and shifting my weight, I'll push through my opposite hand and scoot my bottom along the slide board. Then I'll remove it. If you don't have the functional ability to be able to transfer using any of the techniques or pieces of equipment that we've shown you, then this is likely going to be the best option for you. This is a mechanical lift, or also called a Hoyer lift. As you can see, this blue sling is placed underneath of a person and attached to this device so that the device can be moved to the surface that we're transferring to. Something with this is that we always want 2 people completing a Hoyer transfer. One person should be controlling the movement of the device, like this person in the pink scrubs, and then another person should be standing next to the patient while in the sling, just helping to navigate the environment and provide an additional layer of support and comfortability. Something that I found to be useful for people who might be a little anxious about using a Hoyer lift is to give a demonstration to the patient with some other therapists so that we can show them how safe and comfortable it is to use. As a general overview, when you're going to transfer, see what you can do based on your functional level. It's completely okay if you need the assistance of somebody else during a slideboard transfer, and you should always have the assistance of 2 other people when doing a mechanical lift or Hoyer lift transfer. Also keep in mind your body positioning and make sure that your environment is set up for success. You can get things out of the way, remove clutter off the floor, make sure any lines or trains are also out of the way. If your bed moves up or down, then that can also be really helpful. And if you have any additional questions or concerns about how you can transfer, then reach out to your therapy team and we can help you to problem solve some different methods for you.